Our next speaker, Gita Rampersad, is the Vice President of Healthcare Partnerships and Nutrition at Feeding America. Gita can provide an up-close look into Feeding America's long-standing work to improve access to quality food and how the organization is responding to COVID-19. Gita?
Thanks a lot, and good afternoon, everybody. I am here on behalf of Feeding America's National Network of Food Banks to discuss food security and COVID-19. So I'd like to begin by talking about hunger in America before COVID-19, and some of this has already been touched on by Dr. Hernandez, but this is also the way Feeding America frames hunger. We estimate, the USDA estimates that 37 million Americans struggle to afford the food they need, and this includes 11.2 million children and 5.5 million seniors. Like COVID-19, hunger does not discriminate. We see that hunger affects every community in this country. This is a map from our Map the Meal Gap project at Feeding America that shows the rates of food insecurity across the country. So although hunger does not discriminate, we do see that there are areas that are more highly concentrated when it comes to food insecurity, particularly in the South, the Southwest, and the Pacific Northwest regions. If you were to pepper in this is households that are experiencing food insecurity, and the darker the green, the higher the food insecurity rate. So showing that there's a wide variation by county. But if you were to pepper in households with children, just imagine this map with all of the shades of green going darker, but still staying about the same in the way the food insecurity rates are distributed. So having that in mind, we have to keep in mind that it's important to address food insecurity using an equity lens. Because everybody experiences food insecurity in a way that forces them to make tough choices, we see that other social determinants and healthcare can be exacerbated by hunger. For example, we run a client survey, annual client survey, and our clients at Feeding America report that 69% have had to choose between paying for utilities or food. 67% have had to choose between paying for transportation and food. 66% have had to choose between paying for their medicine or food. And 57% have had to choose between paying for housing and food. I've highlighted because of the audience today, I've highlighted the 66% having to make a choice between medicine and food. This should never have to be a choice. None of these should have to be choices that anybody makes, but this is a reality, and this is a reality pre-COVID-19. So because of these tough choices, we can see that hunger creates an unhealthy cycle. Again, going back to our client survey, we have seen that because when budgets are stretched thin, oftentimes this leads to the purchase of inexpensive, unhealthy processed food. 79% of our households in our network have reported having to purchase these types of food products to be able to stretch their budget. Once that happens, the more unhealthy and inexpensive processed food that's eaten can cause fluctuations in weight and in blood sugar, which then in turn lead to diet-related disease such as high blood pressure, heart disease, and diabetes, and obesity, and which then sends us into an increased healthcare expenditure problem. So we have seen significant increases to the cost of healthcare. But I do want to just point out that in this survey, almost 60% of our households in our network have reported a member with high blood pressure, and a third of our households report a member with diabetes. So these are both conditions that come with dietary restrictions and special diets, and oftentimes that may not be entirely possible when they have to stretch a budget. And as I mentioned, food insecurity leads to higher healthcare costs. We've seen this. Feeding America did a study with the University of California, San Francisco, and we noticed that food insecurity leads to more treatments around chronic disease, more hospitalizations, higher readmissions rates, and to the tune of about $2,000 per person per year, which amounts to over $77 billion in additional healthcare costs per year. So it's really taxing on the healthcare system. I'd like to pause for a minute and just talk about a bit about Feeding America and who we are, for those of you on the call that may not be familiar with a food bank network. We are a network, a national organization with a network of over 200 member food banks, reaching every county in the country, and over 60,000 food pantry and meal program partners. Combined, we are able to provide more than 45 million Americans annually with food assistance. This slide shows that we have been experiencing a decade of growth, despite the fact that food insecurity rates were up until very recently on the decline. We have seen an increase in the amount of people that we are serving and the amount of meals that we have had to provide. So, the white is 2007 and the orange is 2017. Again, I'll mention that we are in every county of the United States, Washington, D.C., and Puerto Rico. We have, this is a map of our member food banks to date. And on our website, we actually have an interactive version so that if you click on any state, you can be directed to any food bank that is serving residents of your state. Now, my background is in health and healthcare, and so when I came to Feeding America to oversee their healthcare partnerships and nutrition work, this is a learning curve for me, and I thought maybe it would be also important and helpful to provide a slide that describes how food banks work. Initially, about over 40 years ago, food banks were created as a community solution to the challenges of poverty, hunger, and food waste. And the infographic at the bottom shows that surplus food is acquired either by purchase or by donation and is then sourced to local food banks, and local food banks in turn package the food and distribute it to over 60,000 of our partner programs around the country, allowing 1 in 7 Americans to be served. So this is a good way for me to understand the food bank model. But I will say that food banks are now addressing a lot more than just food access and food security. We are tackling many of the social determinants of health, plus also engaging in some healthcare activities. Many of our food banks offer job training. We offer safety net resources enrollment, such as SNAP and children's food assistance. We also provide enrollment support for Medicaid and Medicare. We are engaged often in healthcare screenings, such as diabetes screenings and high blood pressure screenings. Food banks offer voter registration. We also provide in some food banks a level of case management, so we have referral systems between our healthcare partners and our food banks, and it allows us to follow up with our clients to see how they are managing their chronic conditions. And we are also engaged in educational partnerships because, as Dr. Hernandez mentioned, part of the food security problem lies in trying to break the poverty cycle. And so we are doing our part to address some of these additional social determinants. And of course, with COVID-19, we can add some more to the list here. I do want to mention that even though Feeding America is not considered a disaster relief organization, we do lead in times of disaster. Right now, our disaster preparedness department is gearing up for hurricane season. It's something we don't know what to expect, but it's not always, it never sounds good. So at the same time that we're juggling our response to COVID-19, we are also thinking about what Mother Nature is going to bring in the form of our hurricane season. But we do have some, incredible resources that we're able to offer to communities and to try to address issues in times of disaster, and that includes over 10 million square feet of warehouse space, over 2,600 vehicles in a fleet that are ready to respond, and close to 90% of our food banks already operate mobile pantry programs that to deliver food into hard-to-reach communities, and these can be operationalized to mobilize around disaster. And I don't want to advance to the next slide without saying that we do count on over 2 million volunteers that typically to help us in our food bank operations. But of course, this has all sort of changed given the current landscape. So now I'd like to talk about COVID-19 and really what we're seeing in terms of impact, how we've been able to respond, and just briefly touching on what recovery would look like. To be honest with you, we are so much still, like right now, focused on our response that it's hard to imagine recovery, but we do know that it's coming. So we're beginning to prepare for that, but we are very much still in the response phase. Initially, Feeding America's response to COVID-19, we identified an immediate need for food and for money from our food banks. So we launched a COVID-19 response fund, which is the national food and fundraising effort. To date, money-wise, we have raised over $200 million, and this continues to grow. This has allowed us to provide emergency grants to food banks to support their local response efforts, and we have already pushed out of that 200 plus million, we've pushed out over 100 million into emergency grants. We have a member grants department that looks at the need every week or every other week for food banks in terms of how much food they have left to in their inventory, how many more weeks they can sustain their operations, and we tailor our grants to meet the individual needs of our food banks. We've also built an inventory of emergency food banks, hundreds of thousands of food boxes, hundreds of thousands of them that are to be distributed to food banks across the country. We did this initially in the first week or so of the response before we were able to get a handle on some of the sourcing and distribution adjustments that needed to be made. But obviously, hundreds of thousands of emergency food boxes is not going to cut the need that we're seeing. But that was one of our initial response actions. And we are able to safely distribute food, non-food, and household items like cleaning supplies, diapers, and personal care products as part of the response. Unfortunately, we have seen a drop in our retail donations, and our cleaning products is one of the items that we see is very hard to come by now. So right now, we are focused on providing food and cardboard boxes to out to our food banks. So we are in the middle of conducting, Feeding America is in the middle of conducting an impact assessment to see how COVID-19 is presenting new challenges to our communities. And what we are estimating is that over 17 million more people will need food assistance as a result of this pandemic. That means that to us, that is a 46% increase in demand. And so this is quite a number for us, but we are responding. We're continuing to respond. But that is the reality, that we have moved from 37 million to over 50 million in a matter of weeks. I wanted to share this graph with you that's been circulating. It's part of a survey that we take with our food banks. we were able to track the amount of pounds of food that Feeding America sourced to our food banks weekly from over the same time period. So from March 8th through April 26th, the lower line is 2019, and the orange line at the top is 2020. And as you can see, there is a marked increase in the amount of pounds that have been sourced to our food banks. Likewise, this is a graph that shows the distribution by the numbers. In other words, the pounds of food that have been distributed by food banks out into the community on a weekly basis. And as you can see, I only have numbers up to the end of April, but the last week in April, we saw a jump from 130 million pounds up to 171 million pounds just in a week. Another reality that we're facing is, the stories that we're hearing from our network. We get these network testimonials that really pull at your heartstrings. And I've included a couple of them here today because it really does put into perspective this, the human side of what's going on. The fact that there are people that are visiting food banks that are saying, hoarding is the last thing that we're thinking of right now. We won't even get by past the next 2 days. We don't know what we're going to do. And of course, I'm sure everybody has seen the news stories with all the thousands of cars lined up at food banks to receive food, and it's not getting any better. Additionally, we have to consider that there are a lot of these families that have special needs, and there's another testimonial here talking about a son with disabilities and people who have special diets, what types of challenges they're facing when they stand in line to get into a grocery store for hours, and then they can't get what they need because they go to the aisle that they need and there's nothing there. So these are some of the stories that we're hearing that are really putting everything into perspective for us. So in addition to the increased demand for charitable food, we have seen declines in donations, as I mentioned, retail donations in particular. We are also seeing an increase in operating and distribution costs at our food banks, along with decreased volunteer support. So we are conducting a biweekly survey with all of our network food banks. The CEOs respond, or some of their senior leadership responds to us to help us understand what the increasing needs are across the network. And as we had mentioned before, 98% of the food banks have reported an increase in demand, with an average increase of 63%. 95% of the food banks in our network have reported an increase in operating expenses with an average of 31%. We've also seen almost 60% of food banks report a decrease in inventory from the same time as last year due to the increased need, and almost 70% of food banks are now accepting additional volunteer support or showing a need for volunteer support. Many of our volunteers are seniors, and seniors are high risk at this, in a high risk group during this pandemic. So, in order to protect their health and safety, they are not always encouraged to come. There's also there's just a lot of new challenges in how we have to operate these days in terms of social distancing, and our distribution models have been adjusted to drive-through and delivery rather than having people come in and purchase them directly. So there's a lot of new challenges, but we continue to see the needs rise for volunteers and other things. I guess to put it in perspective, when it comes to financially, we are looking at, this is a very hard pill to swallow, we are looking at needing an estimated $1.4 billion over the next 6 months. Just the next 6 months to provide food to people facing hunger. Now, this is including the support that we have and are relying on from the federal government, but nonetheless, 1.4 billion is a number that is very hard to wrap your head around, I would imagine. It certainly is for me. But that's our reality right now, and that's just 6 months. There are new emerging concerns that we are typically, as a food bank network, not at the top of our list when we're talking about emerging concerns, but there are new workplace health and safety concerns that have come about because of this pandemic. And so we are addressing these workplace health and safety concerns, along with a much higher need for mental health and well-being resources. People are really feeling the strain of this in various ways. Almost everybody has a personal connection to the pandemic at this point, so these mental health services are becoming more and more critical to be able to provide to our network. We are also focusing more on our high-risk populations, our seniors, our food bank members that have that serve a lot of diabetic populations and immunocompromised populations. We're also seeing new challenges in our rural communities. I mean, rural communities already have existing challenges pre-COVID-19, and now they have even more challenges about how they can access food and of course even health care. We are seeing, as Dr. Hernandez pointed out before, more glaring racial disparities emerging from this, not only in the way COVID is impacting infection and death rates in different for different races, but also in food access. There's always been a higher rate of food insecurity for Blacks and Hispanics, and now that is exacerbated by the pandemic. And finally, we are really turning our attention to the healthcare frontline staff and the issues that they're facing. We are concerned about their health and safety and their ability to get food, because many of these staff are not leaving the hospital for extended periods of time. So that is something that Feeding America has turned its attention to. Part of our COVID-19 response based on those emerging concerns includes sort of a health and nutrition subset of the response. We stood up a public health task force at Feeding America for the first time, which consists of 3 work groups. One is addressing workplace health and safety, another is addressing mental health and well-being, and the third is addressing high risk and health disparities. Those work groups we're providing food banks with emerging practices to tackle some of these concerns. We're also providing technical assistance. And I got to say, we can't do this alone. We're working with our healthcare partners, such as Anthem and other payers and health systems and national associations in academia, really to provide a strength in numbers approach to how do we address the health and nutrition concerns of our communities. We're also engaging in new research studies to address the epidemiology, the economic trends, what's happening with children. I think there's about another additional 7 million children are going to be food insecure as a result of COVID-19. We're looking at disparities. We're looking at how we can provide tools so that people can manage their chronic disease during a pandemic. And then finally, again, we are looking at the front line. One of our projects is we are participating in the Feeding the Frontline initiative with the Aspen Institute and World Health Kitchen to help to develop health and safety protocols. But I think maybe some of you have noticed on the news, food banks are taking it on their own personal crusade to feed the front line just by delivering food to some of these frontline healthcare workers. This slide is just a sample of the public health resources that we are producing, these one-page flyers, so that people can get a quick and easy understanding of some of these new concepts. Not very many of our food bank members were aware of the social distancing and the rules of social distancing, there's a need to upgrade our cleaning and disinfectant practices. So these are 2 examples of changes that we've had to make on the fly, but we've tried to put them out there in easy, sort of user-friendly formats so that they can be adapted very easily, given the fact that, every week brings a new surprise. And just before I end, I'd like to just touch on the COVID-19 recovery. We're looking at, ongoing supply chain shortages. not necessarily food shortages, but there's some breaks in the supply chain that are really presenting challenges and causing us to think through how we can overcome some of these shortages. And one way is by building a comprehensive food purchase initiative. The other major way we are moving into recovery is the government relations team at Feeding America is working tirelessly to to advocate on the Hill for the needs of hungry families. And as Dr. Hernandez pointed out, we are writing a letter to Congress to advocate for a 15% SNAP increase, and it is going to be a sign-on letter. If there's anybody on the call that's interested in signing on with their organization, please reach out to me after the webinar. I'm happy to discuss further. And again, our team of experts in our national office are continuing to provide a range of resources and technical assistance. Oftentimes, this turns into a one-on-one phone call with a person from a food bank who is in distress just because of the amount of stress and trauma that is accompanying the work that they're doing. But I never want to leave on a low note, so I'd like to leave on a high note and leave us with 3 key messages for recovery that let's make sure that we don't lose sight of the fact that equity matters. This is not a one-size-fits-all solution, and we should always be leading with an equity lens. Secondly, partnerships are essential. As I mentioned before, our partnership with Anthem. Anthem has been an incredible partner throughout this response period, and it will continue to be a long-term partner in recovery and beyond. So partnerships are essential. We cannot do this alone. And finally, we always have to remember that brighter days are ahead. We always start our days at Feeding America with some sort of message around hope and healing, and I think that's something that we can't lose sight of. So brighter days are ahead. Thank you for allowing me to present, and I welcome questions later on.